Hi, I'm Carol Ann. I'm an infant and early childhood psychiatrist, and I work at Elm Tree Clinic now. I used to work at CASA Infant Preschool Service as well as the Glenrose, but now I'm out in the community and consulting to agencies as well as participating on PEAS.
Awesome. And I'm Victoria. I'm an occupational therapist and I work at the Glenrose Hospital. I'm one of the co-clinical leads for the Peds Feeding and Swallowing Clinic. I've worked kind of in lots of different clinics at the Glenrose and outpatient treatment. Yeah, so the topic for today is about kind of the mental health landscape for pediatric feeding and swallowing.
ID followed by pound. Otherwise, just press pound to continue.
We'll just use a couple of housekeeping things.
Please enter the meeting password followed by pound.
If everyone could turn their mics on mute. You're welcome to turn your cameras on so we can see your faces.
You are in the meeting now. This meeting is being recorded. You have been added to the waiting room. You cannot talk or listen until the host admits you to the meeting.
Important things. So the session is being recorded and
just like to remind people to use their phones on their computers. Christine, can you check out yours?
okay, let's see. Okay, I think we're good. Perfect. Yeah, so just a reminder that the presentation is being recorded and the slides will be uploaded to the PEAS website at some point in the next week or so. We'll have the chat function available, so please feel free to put your questions there. We have time at the end to kind of go through some discussion and questions. And then we do have some time reserved for a breakout room with some guiding questions at the end of the presentation. Yeah, and I guess just to start with is we understand this topic is quite vast and it's complicated. And so we have lots of other extra questions. So this is kind of our introduction and we're hoping to do a series of presentations around this topic. So lots of unknowns and lots more questions to come, but we're starting here. Just a reminder to mute. Okay, so our objectives for today is just kind of to review mental health resources across to support pediatric feeding. The resources are pretty Edmonton zone focused or things that are available online. Looking at considerations for referrals to access mental health resources, just some different treatment considerations. And in this part, we're kind of going to be focusing on the caregiver and how we can support them. And then we'll be jumping to observational tools that are specific to assessing the parent caregiver child dyad. And then Dr. Hapshin will be kind of doing an overview of the NeuroRelational Framework. And then we'll jump into our breakout rooms. Just wanted to start with a land acknowledgement. This is the first time I've done one. So I just want to begin by acknowledging that we are situated on the Treaty 6 territory, traditional lands of the First Nations and Métis people. This is kind of important for me to do just because working at the Glenrose for the past 10 years, I've worked with lots of Indigenous families across kind of Edmonton zone, Northern Alberta and the territories, and always have looked at ways to improve access to healthcare and making it more meaningful. And kind of in my personal life, I've always been looking for kind of Indigenous art. So this one, there's this one graphic artist, it's from Morningstar Designs, and she has beautiful graphic art that she develops. So yeah. There we go. Okay. So in terms of Edmonton zone resources for mental health supports, so kind of starting off, there's kind of site-specific access to psychology, psychiatry, or mental health therapists. At Northgate, there's a Children's Health Community Mental Health Clinic. CASA is an option where Dr. Hapshin works, Elm Tree Clinic, and then private psychology. Kind kind of in the slide, what we're hoping to highlight too is kind of the gap in options that are available, even just in the Edmonton zone, and kind of the gap in integrated health programs with mental health attached to feeding treatment and feeding assessment.
So I'm going to just jump in, and I realized that when we looked at the slide to prepare, I didn't think about this, but there are other children's mental health clinics in Alberta Health Services besides at Northgate. There's one in Sherwood Park, St. Albert, on the south side. Yeah, so they're distributed. CASA also has distributed sites across the city. Yeah, and Elm Tree Clinic is just right now for kids under 3.5. So this is what we've got in Edmonton zone, and as Victoria said, these mental health services are not integrated with other feeding services. And sometimes I think it's very idiosyncratic how much an individual mental health therapist or psychiatrist might know about children's eating and feeding struggles.
And I think kind of the bigger question with this too is then how can we go and advocate to management? How can we look at, advocating for even a position of a mental health support person, depending on whatever job title that might be, if it's a psychologist, psychiatry, mental health therapist, or maybe social work. How can we look at maybe even increasing FTE? Sometimes we have such little FTE. I know at the Glenrose with our feeding treatment and assessment clinic, we have a small amount of FTE allocated for that, and we could always use more. And maybe how can we advocate for training to kind of improve our skills in this area?
So we just highlighted our limitations within the Edmonton region, and we know that it's absolutely provincial. Yes, and are the services available in Edmonton available to rural communities? I think that's variable, depending on the service.
And I think one nice thing out of the pandemic too is that the option for virtual care, so that definitely would support some of those rural communities, but still not guaranteed. So, and I think it would be nice maybe if people have time, if they can pool some of their, like if you're from a different community or from North Zone, South Zone, other mental health resources that maybe people have utilized. If you want to throw that into the chat, that would be great.
And then Christine's asking a question about, are any of these services for children under 5? Yes. CASA has their core program is 3 and up. So CASA does see preschoolers. And my understanding is within Alberta Health Services, the Learning and Development Clinic also sees preschoolers.
Okay, so I'll jump ahead to, there we go, some online resources. So through the pediatric rehabilitation webinars, I'm not sure if some people have heard of this resource. They do have a specific course that's kind of about supporting caregivers. But we kind of do acknowledge a lot of these online resources are not specific to feeding. And that's something that we think would be great if that could be developed, and how to support caregivers when there are those feeding difficulties. But at least there is kind of a baseline session available for information for healthcare providers on how to support caregivers when they are experiencing fatigue, stress, and it's interfering with the way they're able to support their kiddo through treatment or intervention that they're receiving. So both of these resources. So the first one is triple P parenting. Once again, this one is not feeding specific. Definitely some baseline information on how to manage behaviors, but I think not our first choice in terms of offering this to parents if they are experiencing a feeding difficulty and are noticing feeding or behaviors at meal times. Just something we want to understand why that's happening and understand behavior more. The anxiety website, it's a really good resource for family to look through if they're experiencing kind of anxiety, and anxiety is impacting meal times as well, but also doesn't have specific mental health information. And I think with these resources too, especially the anxiety one, we see lots of kids that are experiencing anxiety. It is nice sometimes to have this as a baseline bit of information for parents to have or for therapists to have, because a lot of these strategies we can apply to kids that are experiencing anxiety around eating and having those baseline skills to manage their, oh, perfect, Liz Matthew. Sorry, I got distracted. So it's great to have those baseline skills and how to apply some coping strategies with their anxiety. Okay, so next we'll kind of shift gears and look at kind of triggers for maybe accessing mental health supports. So kind of our first point here is for a kiddo that has a stable mental health condition or diagnosis, and it's directly impacting their feeding issue. And so we want to look at, who is this person, but it would be ideal to hopefully bring on someone with working in mental health to kind of support the concern, especially if it's a mental health diagnosis. I know we see lots of kiddos that have not yet been diagnosed. So if we're able to consult psychology in some way to kind of help support that, that'd be great. Any of our families that are complex family dynamics, I'd say that's many families. And then kind of the next point is if there's a feeding difficulty that's related to trauma that the child has experienced or the family has experienced. And then any kind of kiddo that's experiencing developmental challenges. I don't know, Dr. Hapshin, did you want to add to?
Well, I guess, we're trying to be specific in suggesting possible triggers for accessing mental health supports. But again, in an ideal world, mental health would be integrated to all feeding teams as an essential discipline to help sort out those variables. So we've included this slide just to kind of cue people as to what to think about. So trying to sort out what are the variety of developmental mental health variables for the child that are contributing to the feeding challenge, and then what is on the parent or family side that's contributing as well, and trying to sort that all out. And it can be very complex.
Yeah, and just kind of to echo that point is, I know that a lot of the kids that are experiencing feeding difficulties across the province, often their first point of access might be a referral to early intervention or community rehab from OT or SLP. So we are seeing these kids that have all these poor things going on, but just highlighting that often can we kind of have a more holistic approach and bring in mental health supports to treat these areas. So this point's kind of going into kind of, the other one was more triggers. This one we're kind of seeing it as more of an essential point that we do need people with mental health people with mental health profession to work on this area is children that have an unstable mental health condition. And then specifically for ARFID, the children that have an ARFID diagnosis, best practice kind of indicates having that have this diagnosis, best practices to have psychology or psychiatry supporting them through this.
And I would echo that. I haven't got anything to add. I think, so if there's concern about mental health for the parent or child, then yes, of course, it's essential to get those variables sorted out. And as Victoria and I were talking about this, sometimes the lack of nutrition and the eating trouble is contributing to the baseline health issue as well as the mental health issue. A quick example about that is the kids that are iron deficient, and then that's contributing to a sleep problem, which is contributing to their mental health problem, which is contributing to their eating problem, and round we go. So there's again, tracking all these variables, we need a team.
Yeah, and I think part of this too is sometimes we'll hear that they need to kind of address their mental health concerns prior to kind of coming to feeding treatment. And part of that same point is that you can't sometimes work on that in isolation because their feeding concern is really being impacted by their mental health or contributing to making it more challenging for them.
And likewise with kids with complex developmental challenges like autism and other neurodiversity. It's kind of some situations we have to work on everything at once and figure out innovative ways to do that.
Sorry, my computer was slow. Okay, so next slide here. So this is kind of more treatment considerations. So we want to look at supporting therapists to kind of have a better understanding or assessment skills to understand the parent-child interactions and their relationships, and how to better support caregivers when they're experiencing challenges that impact feeding. So I think we really want to help balance. A lot of our feeding interventions are very child-focused. We're working kind of on sensory desensitization, chaining foods, all those things are very child-focused, but we're only seeing these kiddos for an hour a week, and the parents are really at the forefront of having to work on these things at home, and we really need to consider how that parent is able to manage and implement these strategies. And when these caregivers are struggling and having a hard time in general, how do we work with them best to kind of work on these things at home? But also part of that is, how is that parent in general interacting with their child, and how is that impacting our ability to work with that family? So I think these are kind of these bigger things that we need to look at.
And in some situations, which is not the most common that we see, but it is definitely there, that the parents' challenges are impacting the child's feeding, that it is a potential cause. So we need to be vigilant for that. But we'll also have to be vigilant that we don't make an assumption that that's the problem either, because it may not be. It can be an and situation. The child has problems with their eating, and the parent also has some challenges.
And I think kind of depending on your model of work, depending if you're doing consultation or assessment, doing a treatment burst, if you're doing virtual in person, or if you're just working on feeding in isolation, maybe from any other concerns that kiddo might be experiencing, how are we able to really get a good idea of that parent-child relationship? And we'll kind of jump to that when we look at some of the tools that could be used.
And I think this is a good time to mention the PEAS Tips for Success video, that there's a series of videos that have been created by PEAS that touch on these issues. So that's for those of you who haven't seen those videos, please find them.
Okay, so just kind of some more treatment considerations, and this is more kind of related to caregivers again. So and these are things I've noticed in my practice, is kind of starting out, can we get buy-in from caregivers? And it depends kind of where they are in the continuum of receiving care. What kind of strategies have they previously tried? Have they had any success with them? What kind of coaching have they experienced from any of the health providers? Are they worried about weight and trying these behavioral or different strategies that are going to work on eating? Are they kind of too scared to work on them because of concerns about weight? And then so I just think that buy-in is really critical from the get-go before we can really work on a family and work through things. Next point is kind of just understanding their general parenting approach. Feeding is one aspect of parenting. And so how does a caregiver generally approach parenting? And I think there's so much information that comes on Instagram and TikTok, and there's so many different approaches. And so I think parents maybe try different things, and it's good to understand how they've maybe worked through other struggles previously and how we can kind of bring that into our treatment and understand it.
We do live in a world of social media and some real disinformation. So unfortunately, I think lots of parents are coming to us with lots of misunderstanding as well, and maybe of trying things that aren't helpful and actually may be setting things going in the wrong direction.
Yeah, exactly.
I'm just going to switch.
And then I think understanding the level of coaching that a caregiver might require to kind of work through some strategies can be so vastly different across caregivers. So kind of understanding, the frequency that they require, the kind of modality that they might need. And this can be kind of an interesting conversation to have, like to kind of know which parent requires what type of help. And there's a large spectrum of that.
And in this way, sometimes I think we're limited in our system of care in that we do a lot of top-down talking, giving handouts, giving written information, giving verbal information. Some parents need hands-on, in the moment, being at show and tell and modeling. And that's way more time intensive. And that's an issue, I think, for some families. The issue for the family to spend the time, and issue for us to have the therapeutic time needed.
yeah, and the ability to even to like fade out the level of coaching required and kind of work through that progression with the caregiver, I think something that's hard to work through. And then kind of, I think there's been some comments in chat, but yeah, the food baggage. So what is the caregiver bringing to the table about their attitudes toward food, their own personal experience with eating, general mealtime hygiene that they're comfortable with at home. What does that look like for them as a family? Eating practices in general, like what type of cooking, what kind of things are they typically doing? Because we don't want to introduce something that really doesn't make sense to them as a family. But I think that attitudes towards food is really a key thing. Yeah, if they have their own selective eating, a history of eating disorder, these are important things to kind of have an understanding when you're working through a feeding treatment plan. Because so many times I think I've experienced too, I'm like, oh, what is your eating practice? And then you hear a lot that there is selective eating going on in the parents in the household. Or just the shift, I think, not to mention social media too much, but also, you know, what is a healthy lunch that you can send your kiddo to school? Financially, what can this family afford? Can they make these beautiful bento boxes? That's a rainbow colored thing. Or, you know, at this point, can they afford certain foods? And really understanding that perspective, I think, can kind of help carry along a treatment plan as well. I think I worked with a family recently where we did virtual care and we talked about vegetables, and kind of near the end, it was a miss on our end that we were working on fresh vegetables, and near the end, mom was saying that she had to consider her budget to go and buy vegetables for our virtual sessions, and realize it wasn't feasible for them, and frozen things actually would have been more feasible. And I think it really impacted our success or buy-in. Yeah. And then maybe Dr. Hapton, do you want to speak to the parent?
Yeah, I'll speak to the last one, parent attuning to the child's cues. So this is something I think that, you know, all practitioners, regardless of discipline, that this is something that we all can work on, is really understanding and knowing our capacity to assess the parent-child interaction and be monitoring how well the parent is monitoring and responding to the child's cues. Because that impacts all of parenting, but feeding in a very, feeding is super important for especially for younger children, for the parent to be monitoring cues accurately. So this is something where many practitioners need more support and training. And again, teams work well for this, because what one person doesn't see, another will. So this morning I was with a student and she said, "Did you notice the child picking the lint off their socks?" And I said, "No, but thank you. That helps me with my potential diagnosis that's coming down the line." So, you know, we can't even one practitioner see everything. And videotaping can help with this. If you are a solo practitioner, is to have a chance to reflect and look at an interaction and see if you've missed anything. What's going well and what may be a challenge. So these are two tools that are available to help guide our observation. The first two, the Piccolo, is simple, and there is online support to kind of learn this tool. And it's a very simple checklist of domains of what to look for when you're looking at a parent-child interaction. So this one is probably more easy to uptake for any practitioner of any discipline. The second one is a bit more complicated. This tool where we can look for atypical behaviors. The original version is a very complex research-based tool. But one of our very own Alberta researchers in Calgary has created a brief version of it. The training is still intensive, so this would not be for every member of a team. But again, potentially for the mental health practitioner or other interested clinicians, this may be a useful training. And what it is specifically helpful for is to guide the practitioner for being vigilant about atypical behaviors that are contributing to the interaction not going well. So one example is intrusive behaviors of the parent, where they may be physically intrusive with their body into the child's space, or physically intrusive with objects or toys. And if it's a repetitive kind of behavior, then it may be contributing to the interaction and the feeding not going well. So these are two tools. We're throwing them out there for consideration today, and just kind of as a teaser. If there's a desire to learn more about this, we could include this in a future COP.
Okay, and I see there's a question from Amy.
Yeah, there's a good question in the chat about, are there tools for self-awareness for a parent to kind of monitor their own? You know, there actually are. There are some simple tools. They're not detailed, but there are some simple tools for parents to monitor. So we'll make a note of that, and we could put that on the list for the next COP.
Yeah, that's great.
Thank you.
Okay, so now we will kind of switch gears, and Dr. Hapshire will jump into, oops, sorry. There we go. Okay, the NRF.
Okay, so I'm only going to give a very brief overview this afternoon. It's going to be very short, just again, to give you an awareness that there is a framework out there that is holistic, that can help us on our feeding teams hold all the variables, and it is called the NeuroRelational Framework. More information at this website. I think Victoria has a document from Alberta Health Services with the links to some videos, some trainings I did a few years ago, as well as the website, and I think we're also sending out a handout about a series that I'm doing with April Prescott, a mental health therapist in the community. It's through Edmonton Regional Learning Consortium. We have a slide on that, and yes, we will give you the slides with the links. So there's other training available. So this is just a quick overview to kind of see if you've got an interest in learning more. So next slide. This framework was written up as a textbook in 2009, and we've been working on a user-friendly manual, which is online. Some of these handouts are available for free in our starter kit, and they're also, the older versions are handouts attached to the HS learning. That's very hard to find in the intranet, so that's why we're sending you the one-page document with the links. So the NRF is a framework where we're trying to integrate neurodiversity of all kinds, developmental challenges, as well as trauma-informed care. And we start off understanding a situation with any individual as to whether they are in a state of safety, whether they are experiencing an appropriate challenge during their day, or whether they're overwhelmed by an inappropriate challenge or an actual threat in the environment. And this triad of understanding safety, challenge, threat is extremely important in feeding situations, because we need kids and parents to be in a calm, alert state when we're attempting to learn a new skill. And then offering the appropriate challenge for them to learn a new eating or feeding skill. Next slide. So what the NRF sort of a value add is that we've created a tool called this Awake States Indicators tool that helps us observe, another observational tool, to look for biobehavioral markers of states of arousal in the adult and child, and applying it to ourselves as to what state we are in when we're providing care with our families. So this is a tool where we can sort out whether a child or parent is having a stress response, whether they are actually in the green zone, which is a calm alert state. Next slide. So companion to this tool is a tool where we're trying to track involuntary visceral cues. And again, very important for feeding, in that if the body is not calm and that we are seeing signs of stress in the body, then we need to be coaching our families to back off and help the child get calm. And you'll, if you want to click on the next one, I think I've got overlaid here. The GI tract is, there are very many markers of visceral cues here, signs of stress, from subtle to moderate to severe cues. And I think sometimes we look at these as physical symptoms, but they are, and they are signs of stress reactivity in the body. And again, this goes across all disciplines to know this information. And of course, these visceral cues are tied into our interoception as part of our sensory network. Next slide. So important to sort out stress reactivity, these states of arousal in our patients, and sort out, is this child or parent in a toxic stress pattern? So are the stress responses too long, too intense, too quick, too frequent? Is this child having trouble habituating to typical demands during the day? And the worst case scenario is that there is minimal green zone. There is minimal calm alert state for this child or parent on a chronic basis from day to day. In that case, if a child or parent is in toxic stress by this definition, then we need to support them and figure out what are the causes of that toxic stress and provide intervention and treatment. And that can be from the point of view of multiple variables, which again, this framework holds. Next slide. The framework also talks about relationships. So there's neuro, about our nervous system, the importance of neuroscience contributions to our understanding of kids and families, as well as the relationship. And so the framework talks about the importance of adults co-regulating children, and that co-regulation is what supports the development of self-regulation. So that's what this diagram is about. The cone in the center represents our development of self-regulation, which proceeds over time, always in the context of the other, providing strategies and support and holding the child during their development to learn self-regulation. And of course, this is hugely important for any feeding situation. The adult is always co-regulating the child throughout. Next. And this slide just shows that there are individual differences in the development of self-regulation, that it takes some kids longer to develop some skills, and some kids, because of neurodiversity of whatever kind and or physical health challenges, may not develop the same self-regulation as other children. And we have to be mindful that they will need more co-regulation over their course of childhood and into adulthood. Next slide. So the NRF organizes data in 4 brain systems. And these 4 brain systems help us organize all our data from different perspectives, from different disciplines' perspectives, so that we can provide a holistic intervention. Next slide. So this is brains built from the bottom up, from top to bottom. And so what I've been doing with different clinical teams in the community and one team in AHS is helping them organize clinical data, again, from all disciplines' perspective. And we use this, again, teaser, this trigger and toolkit chart to help us organize the data. So then we can create a very holistic treatment plan where we're sorting out the priorities of treatment. So we're providing the right help at the right time with the right people on the team. And that we explain this in a holistic way to families so they know what's going on. Next slide. So if you want to learn more, if I've given you enough information to whet your appetite and have you be curious, this is a free workshop. Edmonton Regional Learning Consortium, the Department of Education is sponsoring this. This series of sessions is at 7 o'clock on Wednesdays, 7 to 8, 1 hour, short and sweet. You can watch it in your PJs at home on Zoom, and starts at 7 o'clock. So if you want to register, then please go to that link. We're gearing this session for families, and it is again oriented towards families and educators, but any discipline is welcome to come. And I think there was a question in the chat. Can you give us some examples for the chart slide? Yes, I would love to give you examples. I think we were gonna, that is another, sorry, I keep saying that I'm giving you teasers, but I would love to do that with you and do a feeding case and show you how the trigger and toolkit chart works. And we could do that in another COP.
Love all the questions.
I'm glad we're collecting lots of ideas for the next steps.
Yeah. Okay, so we kind of, went through all our content. We understand, very introductory. We have lots more questions and understand lots of gaps that are kind of going on in care. But wanted to at least bring everyone together and even pull resources. I think there's lots of things even in the chat that I was not aware of, so it's really great. So hopefully we can kind of compile everything so more people can be aware of what's available out there. Perfect. So yeah, our plan now, we're gonna go into our breakout room. Yes, the link will be, and I can maybe even put it in the chat so it's just accessible now. I can put it in there. So now we're gonna break into the breakout sessions. So it'll be about 5 to 6 of us in each of the groups, and just kind of some guiding questions. Just want to look at a bit of a discussion. What are kind of the current gaps in your practice for accessing mental health resources? What do you find most challenging when interacting with caregivers that are struggling? And then what training do you think would be helpful for you or even for your team? Yeah, we're open to all these ideas. So perfect. Okay, Crystal, if you can help us break out.
Like to see if
Hi, Crystal, would you be able to just like paste the discussion questions in the chat for us? With kids, the other challenges that we talked about is that the kids with ARFID or the parents with, or parents and children who will eventually have feeding disorders are not
There's a
short-term
pediatric advice line, or there's an advice line that they can, but you can give it to families, like if they need suggestions
mute,
for
please.
mental health stuff. And
Oh, cool.
yeah,
Mute.
So I was just saying, so we moved into this model of episodic care, and I think that's part of the other challenge now, because these children who are having feeding and mental health disorders, plus their parents having mental health challenge, these are not short-term episodic sort of situations. And I think that's going to be another challenge that we're going to be looking at in the future as well. I think that's what I heard from our group. And the other thing that we really want to, I think as a community program, we really want to know about more about ARFID, get more information about that. I think the community pediatric program in Edmonton has been so fortunate over the years to have Caroline Hapshin supporting the training around NRF for our team, my old team. That I think we feel very confident with that. But, you know, how could we clone Caroline to the rest of the province is really my question.
Or how can we do the COP that I wanted to do about the NRF for the province that never happened?
No, that we talked about a lot,
Yeah.
but maybe
So
that's something
I'm
that
still up for it.
I can talk to Stephen and just see if we can get that going again.
So thanks
Carolina,
everyone for coming back from their rooms, and sorry for.
Oh, Crystal, you got muted there.
Oh, I've never done breakout rooms for that many people, so it was a learning opportunity for me. Anyway, Victoria and Caroline, I'll give it back to you.
Yes, thank you. Thanks for working with us today. Is there any other groups that want to share any of the kind of themes that came from their discussion? Even one group would be lovely.
I can speak for our group really quick, and then if someone else wants to jump in, we just agreed with what Liz said and identified that MyLink learning courses on specific topics would be useful, that getting the outside experts in and then having opportunities for discussion in this kind of forum of a community of practice about the experts' teachings would be useful. Standardized orientation for teams about feeding would be useful. Yeah. And then same echoing of needing more training and more integration of mental health into the teams. Anyone else want to echo that or have any other kind of additions?
Dr. Spicer?
One of the things that came up in our group is some apprehension around the reorg of Alberta Health Services and the various components of, and moving to the 4 pillars of mental health and addiction, primary care, acute care, and what did I miss? It's the other one. I know them all, but I forget which ones I said, didn't say. Anyway, the 4 pillars, because feeding and feeding disorders will span all of those. Primary care, acute care, continuing care, and mental health and addictions. And so really some apprehension and some concern that those things don't get parsed out, and that there needs to be integration among those pillars and among disciplines, and all of those things available for families in a seamless manner. So while there isn't really a lot of information yet about what those organizations or pillars will look like, perhaps we should be preparing a little bit to have some messaging ready for the importance of this population.
Great, thanks for sharing. I know that lots of questions about what that will mean for our work, so we'll have to wait and see, I guess. Any other groups want to share? I'll quickly highlight just a few things from my group that I thought were great. Kind of learned that with someone from our group that mentioned that they have a social worker on their team that does provide some counseling to caregivers. So that was kind of nice to see. Some, the role can be so different across sites, but it was great to hear that there was some kind of counseling that their social worker was providing for kind of caregivers that are having some difficulties. And just some resources that are available. There's kind of on My Learning Link, the kind of trauma-informed care. Some therapists found that a useful tool. And then I didn't know this, but I guess there's mental health first aid. I've heard of this. Fascinating. I'm behind. Okay. But also this is a place to learn. So
yeah. And mental health at first aid is good for just overview basic stuff. Yeah. But it is evidence-based and it's useful.
Yeah, and I think there was just a comment too. Yeah, like the observational tools are great, but also what kind of maybe screening tools can be given to caregivers before they come, and that could kind of just help inform how you proceed through the treatment first. Awesome. Okay. Anybody else want to have some comments here before we jump to, I guess, general questions? All right, so yeah, that's kind of all we have prepared for today. Like we mentioned, very much an introduction kind of to the topic. It's a hot topic. We're all here because we're kind of passionate about it. So I think what I'm going to do is kind of compile some of the resources that were all shared in the chat, and we can send it out on the COP website. If you have any other resources or any other programs that you think would be of benefit for other people to know, definitely please pop them into the link. I think that'd be really helpful. Yeah, any kind of general comments, questions, thoughts, future topic ideas around this? We're open.
Yeah, can I just put my hand up? I mean, Carol, I know you said you would like to do relational feeding, and that was actually something that came out of the PEAS project as an interest for everyone. So I'm not sure why we couldn't do that as one of these COP sessions. Is that something you guys were planning? You were planning a follow-up to this one?
Yes, we're planning a follow-up. Yeah.
Okay, so which will be more sort of practical, hands-on.
But it's relational components in the context of the rest of the whole.
Yeah.
Because as Dr. Spicer mentioned, feeding is across brain networks and of course the body. So it's complex just right from the get-go.